Good afternoon. Thank you for joining us. For those of you who don't know, to my right is Dr. Howard Zucker, the Commissioner of the State Department of Health. To my left, Beth Garvey, who is my special counsel and special advisor. We're here today to discuss vaping and e-cigarettes. Our advice, our guidance is quite simple. Don't do it. Don't do it because we don't know that it is safe. There's been a significant increase in the number of illnesses, even deaths across the country. CDC estimates about 500 that are linked to vaping of certain substances. And this is a frightening public health phenomenon. It's an activity that many young people engage in. And common sense says if you don't know what you are smoking, don't smoke it. And right now, we don't know what you're smoking in a lot of these vaping substances, etc. The Department of Health is going to take several actions that Dr. Zucker will explain. First, the Department of Health is starting an investigation into some of these companies that produce vaping substances to find out exactly what is in it. There has been some evidence that vitamin E acetate, which is used in many of these vaping products, has significant health risks associated with it. So the Department of Health will be starting that investigation and will be sending out subpoenas to that end. Second, the Department of Health is going to require that shops that sell vaping e-cigarettes post a warning that lets people know that this is a risky adventure and a risky activity. And third, I'm going to be proposing legislation for the new legislature that will ban flavored e-cigarettes. It's attracting thousands of young people to an activity. And again, we don't know exactly what they are smoking or what the consequences are. And I'll be putting forth that legislation. With that, let me turn it over to Dr. Zucker to give you more details.
Thank you, Governor. So let me share a little bit about what we know. We know we have 41 patients in the state of New York. Right now we have 13 samples in 8 patients. We are continuing to get more samples. Our Wadsworth lab, our state public health lab, has been analyzing them. We have found, as the Governor mentioned, high levels of vitamin E acetate in the samples. Vitamin, just for education purposes, vitamin E, when high levels of vitamin E are inhaled into your lung all the way down to the small air sacs in your lung, it can damage those lungs, and since those air sacs are where you get oxygen and into your body, obviously you can get quite ill, and that's why we've heard, unfortunately, of 5 deaths in the nation from this. These symptoms for people to be aware of: if you have shortness of breath, fatigue, nausea, vomiting, chest pain, cough, any of those symptoms, headache, you really should see your doctor if you are using a vaping product. As the Governor mentioned, we have hundreds of cases across the country. There are 33 states that have reported this. And across New York State, as I mentioned, 41 patients. This is what we're doing to get more information at this point. We have issued a health advisory to hospitals and to health professionals about this issue. We are working with all of our counties across the state. This is obviously an extremely serious issue, and our lab, our Wadsworth lab, is testing all the samples that come in from New York, and also some of our neighboring states have also asked for us to do analysis. The Department of Health has a website as well as a hotline for anyone who has any questions. We could provide all the information that they need about this, and I strongly urge people to go to that information. As the Governor mentioned, we will issue a subpoena to get the companies who are marketing some of these thickening products to get more information from them, and there's more parts to that subpoena, obviously. We're expanding our investigation. We're also broadening our public health awareness campaign. The poster that you see will require vaping shops to actually put them out there if they are selling these products as a warning sign, and we will be working with our Public Health Policy Council, which worked through the process of getting that approved. And the last thing is, what can the public do? What can people do? So I would urge everyone to be very much aware. I would say that don't buy any black market products, and as the governor said, we recommend that you not use vaping products until we get more information about this, and our guidance will obviously change as more information becomes available, but right now that's the most important thing to do to protect the public's safety. Thank you.
You said that the third thing is to ban flavored vaping products. Would that mean that others that are not flavored are okay? And also, why not just go ahead and say, because of the confusion, we don't know what's causing this, just ban them, just say you can't sell them? Is that possible?
Well, it's a good question. We want to know what it is first, right? The FDA theoretically tests and approves some products. But what we're finding is we just have a lot of questions. You have these illnesses. We've started an investigation to find out what the products are. We'll see what we find out, what the evidence is. It may very well lead, at the conclusion of the investigation, to a call for banning all products. Again, some of the products are approved by the FDA, so we would probably be preempted by the federal law because you can't ban that which the federal government approves. But depending on what the investigation actually finds, we could expand that action, certainly.
All the illnesses, were they in cartridges that were bought illegally on the black market?
That is correct. They were purchased cartridges with cannabinoids in them, cannabis in them, and they were, as we understand, on the black market. And if you go to our website, there's also pictures of the products that were there.
So, Governor, if that's the case, why ban all products, or why call for all and end all vaping products? Some people do it safely. It's a good alternative for them for smoking.
Well, the medical marijuana, this does not include, Zach, the medical marijuana products, right? Those are regulated and those are safe. But what we're saying here is we don't know what a lot of these substances are. And you have an alarming rate of illness. And our advice, our recommendation, common sense, if you don't know what it is that you are smoking, don't smoke it, right? That's the basic advice recommendation that we have. The legal action we would be taking would be on the banning of the flavored e-cigarettes. And we know the risk and the growth in that area. But other than that, we're saying we're going to do an investigation. We're going to look at these substances and what's actually being used and what these devices are and the consequences of the devices. Until we have the information, why would you take the risk?
Governor, Michigan's governor had put in like a temporary ban on flavored e-cigs in light of all of these, the 2 deaths and hundreds of people getting sick. Is that something that you're considering the legislature doesn't go back to session until January, so there's some time in between now of you proposing legislation to when it would actually go into effect? So what about these next couple of months?
We're exploring all legal options, and that's one of the options that we're exploring.
Governor, is it your belief, is it the belief of the health department that this vitamin E acetate exists only in black market products that people are obtaining, or is it all products, and is that what you're exploring?
So the vitamin E is the way what's happening in the black market is that if they're putting in cannabis into a cylinder to use as a vaping product, let's say they use half of it for that, and they fill it up the other half with a vitamin E acetate. So now up to 50% of that canister that ultimately vaporizes is vitamin E. What we have found is all these products that had the vitamin E were purchased on the black market. Yes.
So you're saying that the products that are not purchased on the black market don't have this chemical filler as
What we have not found, of all the samples that we have looked at, they have only come from the black market products. That's correct.
So are you telling people that it's safe to go to regular vaping shops if you're buying products that are well known?
So it's an interesting question. The issue here is that this is what we have in New York, but we do know there are 450 plus cases around the nation. We understand this is an indicator, the vitamin E is an indicator that there's a problem here with those specimens that we've gotten. But for all we know, in other parts of the nation, there may be other things that are fillers in there. And I think it's important that at this point in time, to err on the side of caution, as the governor said, and to not use any products.
Can you explain why the vitamin E acetate is dangerous and what it's
Sure.
doing to the body?
Sure, so the vitamin E, if you look at it from a chemical standpoint, it has a lipid, which is sort of a fatty kind of component to it. And if you inhale something all the way down to those small air sacs, and you inhale something that's oil or fatty into there, it damages the lung, and you can end up with pneumonia, and you end up on respiratory support. And that's what's happened to a lot of the individuals.
And it's the vitamin E acetate that's causing it.
The vitamin E acetate, right, has an oil, but there may be other, that's one indicator, but there may be other substances that also have that kind of oil to it, that when you inhale at a very high temperature and or it's heated to very high temperature, and then you inhale it, it will damage those small air sacs in your lung.
Yeah.
A lot of people take vitamin E, so should they?
It's a different story. So this is something that happens all the time. People may not recognize that when you take something by ingesting it one way versus inhaling it, it's different. How your body metabolizes things is much different, whether you breathe it in, whether you take it by mouth, whether you inject it through when you're in the hospital with an intravenous. So I think that people should understand how things are given are much different.
You're not telling people to stop taking vitamin E.
I wouldn't say if you're using it, that's a vitamin E from a reputable company that you're taking as a supplement. That's one thing that's already been tested, but this is not what's happening. This has not been tested. It's on the black market. It's been filled into these canisters, and it's going directly into your lung.
Yeah, I think, Marcia, I think that's added to the confusion, frankly. A lot of people take vitamin E. Vitamin E has been associated with certain benefits taken as a supplement. Smoking vitamin E is a much, much different situation than taking a vitamin E supplement. And as the doctor explained, it has been linked, although not necessarily determinatively yet, to a lot of respiratory illnesses.
I think, a lot of people, when they look at the products on a vaping thing and it says vitamin E, they say, oh yeah, that's really fine, I take it, whatever.
That's right.
And then they think that the product is safe when you're saying it's not.
That's right.
Well, I guess the question is vitamin E also in these commercially produced products? Have you found that, or
We
is
have-
there another substance?
In New York, we have not found that in the commercial products.
What would make that like a jewel different in New York versus sold in
Well-
California? Isn't it uniform across the
So
country?
let me explain what the vitamin E, what it is basically, it's a thickener, it's a filler. So if you have this glass of water, and this was the whole substance that was ultimately going to be vaporized, and half of this was the THC, the cannabis, and they were selling on the black market, they have to fill the rest of this with something. So they're going to fill it with a vitamin E. Whereas if something is a jewel product, will be filled, let's say, with nicotine, and whatever else that's in there is going to be the whole thing. So that's the difference, and that's why it's called sometimes a filler, because it has to fill up the canister.
But why a warning about all vaping products? Why not just say, don't buy, black market vaping products? Why are these going to be going up in places that sell jewels and, regular cigarettes?
Well, it's what the governor said, that when you don't have all the information yet, and this is an ongoing investigation, there's more information, you have to err on the side of caution. And so we're suggesting to everyone in New York to err on the side of caution until we have more information, and this is an ongoing investigation, and I'm sure we'll have more information as the days go forward.
Yeah.
Does the
The
FDA
truth is-
regulate Juul and the other large, at least the large ones? I know there's aside from the black market, I gather there's a bunch of large mainstream ones and then many, many smaller ones. But to what extent is this already regulated by federal authorities?
So the black market products are obviously not, and the other ones, the federal government, there's a whole discussion with the FDA of what has been approved and what has not been approved by the federal government.
Yeah, excuse me, a second. The CDC, on the federal side, the CDC recommends against vaping basically as a blanket statement. So you would think that there would be coordination between the CDC and the FDA. There's not.
Well, the CDC also recommends against tobacco smoking, but we allow it and the FDA regulates it. I guess just by the same token, does the FDA regulate standard vaping products?
The FDA looks at these products, and certain things are regulated by the FDA, yes, but they have also been pushed back a little bit about some of these things have not been studied carefully enough, as they had mentioned today.
How many companies will get these subpoenas, and is there any sense in terms of what percentage of the market in New York are people who are buying on the black market as opposed to?
So three companies that will get the subpoenas. I don't know the percentage. 3.
And what percentage of people who vape buy on the black market?
Don't know that.
I mean, is it a larger percentage? Is that?
What percent of the market do these 3 companies represent?
Yeah, and what percentage in New York are people buying on the black market as opposed to, more regular companies that may not use vitamin E acetate?
We can get you those numbers.
Howard, forgive me, you say there are 41 cases?
There are 41 cases right now, correct, in the state of New York.
Okay, because it was 34 on Friday.
That's right, and then there was 39 over the weekend, and now it's up to 41.
And it's
We're-
all with black market products.
Well, we haven't analyzed the other specimens coming. Remember, it's not so easy. Someone shows up, and all the ones that we have samples from are from black market products. But sometimes people don't share information, and that is perhaps what's happened even in some other parts of the country. People may not say, oh, by the way, I got this product on the black market. But whatever comes in our Wadsworth lab, which is an unbelievable public health lab, is analyzing those specimens.
Were you distinguishing between THC pods versus like tobacco ones? Because my understanding with the 2 people who died, both were vaping THC, and a lot of the media coverage has been just broad vaping, which I think most people think of as like nicotine, tobacco, Juul, rather than marijuana.
So of the 13 samples that we have, they were all from THC, and there was one sample that there was one sample that was from nicotine, but when we tested the patient themselves for in their urine analysis, there was actually THC there. So we anticipate that probably sometimes people, as I said, don't share all the information.
Are you thinking about changing your approach on how you talk about it? Because that's been kind of confusion, I would say, on the media's end of just being more broad rather than specifically talking about the dangers of smoking THC with these pods.
Well, I think as the governor mentioned that we should stop vaping until we have more information about this, and that's what the hotline as well as the website can provide more data for you. And as we get more information, we will put that on our website so that everyone has the most up-to-date facts about what we're finding.
Yeah, but the inverse is, I don't think you're going to get any health official who will say to you today, vaping is safe, because they have not studied the substances and the devices and the combination of the 2. And the numbers of increase in usage are skyrocketing, and the number of illnesses are skyrocketing, and you just don't know. I mean, there are a lot of questions, and there are very few answers. Do you have the names of the 3 companies?
I have them right here. There's Honeycut Labs, LLC, based in Santa Monica, California, Floraplex Terpenes in Ypsilanti, Michigan, and Mass Terpenes in Amherst, Massachusetts.